Myself, Dr. Santoshi. I am discussing about maxillary anatomical landmarks. Coming to the definition, anatomical landmark, a recognizable anatomical structure used as a point of reference. Basically, the anatomical landmarks are divided into two: limiting structures and supporting structures. Supporting structures again divided into stress-bearing areas and relief areas. So, limiting structures: labial frenum, labial vestibule, buccal frenum, buccal vestibule, hamlar notch, posterior palatal seal area. Labial frenum, it is a fan-shaped structure attached from the crest of the ridge to the lip. There is no muscle fibers in the labial frenum, it is a purely fibrous tissue. Labial vestibule, the boundaries of the labial vestibule on the right side from the buccal frenum anteriorly to the labial frenum, medial side the crest of the ridge, and labial side labial mucosa. Buccal frenum. Buccal frenum, it is when it is a single, it is called as a frenum. When it is a multiple, it is called as a freni. Here, below the buccal frenum, it is consist of orbicularis oris muscle, levator anguli oris, and buccinator muscle. When the orbicularis oris muscle pulls the labial frenum towards the anterior side, buccinator muscle pulls the labial frenum, buccal frenum towards the posterior side. So it has to be relieved properly in the complete denture. This is the in the impression, it is present as a frenal depression. Buccal vestibule. Buccal vestibule boundaries are anteriorly it is a buccal frenum, posteriorly hamlar notch, medially by the crest of the ridge, and labially buccally by the buccal mucosa. Here the posterior buccal sulcus is influenced by the coronal process of the mandible, so it has to be relieved properly in the impression. To record the coronal process, ask the patient to open the mouth slightly and ask them to shift to the other side. So we can record the thickness and as well as the width of the buccal vestibule. Coming to the hamlar notch, it is a posterior limiting structure of the maxillary arch. Here the hamlar notch is presented in between the maxillary tuberosity and the hamlar process. To record the hamlar notch, ask the patient to open wide. Here there is no muscles are attached here, but pterygomandibular ligament is attached to the hamlus. That's the reason ask the patient to open wide. Hamlar notch, this is a hamlar notch. And posterior palatal seal area. The definition of the posterior palatal seal area: the soft tissues at or beyond the junction of the hard and soft palates, on which pressure within the physiological limits can be applied by a denture to aid in the retention. The posterior palatal seal area, it is a area. Why it is called as area is it is present between the anterior vibrating line and the posterior vibrating line. The anterior vibrating line, this is the anterior vibrating line, and this one is the posterior vibrating line. Laterally, it is bounded by the hamlar notch. Coming to the supporting structures, basically it is a stress-bearing areas. The primary stress-bearing areas, where the characteristic features of the primary stress-bearing areas are: the bone should be dense and it's covered by thick fibrous mucosa, and it should be resistant to the resorption. Hard palate, it is a primary stress-bearing area of the maxilla. Hard palate, it is a perpendicular to the forces, that is why it's called as a primary stress-bearing area, and the submucosa is thick. This is a hard palate. These are the horizontal shelves of the hard palate. And this is a rugae area. Rugae is called as a secondary stress-bearing area. Why? Because it is slightly angulated to the forces. It resists the lateral forces. And slopes of the residual ridge also considered as a secondary stress-bearing area because it is angulated to the forces and it resists the lateral forces. Rugae is a secondary stress-bearing area, and it aids in the speech. The dense mucosa aids in the speech. These are the folds of the rugae. And sometimes it is also called as a relief area. Why? Because the dense tissue, it has got a reboundable property. So when it is prominent, we need to give the relief on the complete denture. Coming to the maxillary tuberosity, it is a bulbous extension of the residual ridge. It is considered as a secondary stress-bearing area. Why? Because it is covered by a sometimes loose alveolar tissue. This is a tuberosity. And coming to the relief areas, why it is called as a relief areas are: here sometimes the submucosa is very thin, or it is covered by the vital structures, or if there is any bony prominences, we need to give a relief area, otherwise it leads to the ulceration and necrosis of the tissue. The relief areas are incisive papilla, cuspid eminence, mid-palatal raphe, fovea palatina and torus platinus. Incisive papilla. This is the incisive papilla. Here it is covered on the incisor foramen. Through the incisor foramen, the incisal nerves and vessels are emerges through the incisive foramen. So when you compress the incisive papilla, it leads to the necrosis and paresthesia of the upper lip. That is the reason we need to give a proper relief over the incisive papilla. And coming to the cuspid eminence, it is a bony elevation on the residual alar ridge after extraction of the canines. This is a very prominent structure. Here the submucosa is very thin. So while placing and removal of the denture, it leads to the ulceration. That is the reason we need to give a proper relief over the cuspid eminence. And coming to the mid-palatal raphe, it is formed by the joining of the two horizontal shelves of the palate. So this is called as a suture. Here the bone is very prominent and the covering mucosa is very thin. So this prominent bony elevation acts as a fulcrum point and it leads to the rocking of the denture. That is why it is called as a relief area. And coming to the fovea palatina, there are two depressions on either side of the mid-palatal raphe at the junction of the hard and soft palate. Here the mucous glands or ducts of mucous glands are present in the fovea palatina. So if you compress this, the secretions of the mucus leads to the dislodgement of the denture. That is why we need to give a proper relief over the mid-palatal raphe. And torus platinus, also called as palatal tori, it is a bony overgrowth in the mid-palatal suture area. So because of the overgrowth of the bone, here the submucosa is very thin. So if you compress this area, it leads to the ulcer formation. So that is why we need to give a relief over the torus platinus. Thank you.